Welcome to the world today. I am Amarachi Ubani. Let's get down to the major story. Hospital in Dallas, where the new case was announced on Sunday, has already faced criticism for its management of the infection. Meanwhile, in Massachusetts, a man who recently returned from Liberia is being evaluated at a Boston hospital for a potential case of Ebola after complaining of a headache and muscle aches. The patient is at Beth Israel Deaconess Medical Center, but thankfully, there seems to be no confirmation of Ebola just yet. The response in Massachusetts demonstrates the high state of alert medical facilities are under since a Texas health worker became the first person on Sunday to contract the disease in the United States. She had treated a Liberian man who died of the deadly virus last week.
The plan that we had in place for a couple of months now, and so that plan is being executed, and we feel comfortable that it is working in a way that protects our patients and our staff. We have a team appropriate for the patient that's available to take care of the patient.
Sand said if Ebola is suspected, doctors will test him for the disease, possibly with the help of the Centers for Disease Control and Prevention in Atlanta. Testing would take 24 to 48 hours. There have been several Ebola scares in the United States in the past week. A plane was briefly quarantined at a Las Vegas airport on Friday after a passenger reported feeling unwell. Health officials around the country have fielded scores of possible cases that were false alarms. The current Ebola outbreak is said to have killed thousands of people, mostly in Liberia, Sierra Leone, and Guinea. The VOA's John Walker joins me now from studios in Washington, D.C. John, thank you for joining us on The World Today. What do we know now about the status of the health worker?
She's listed in a stable condition right now at Texas Health Presbyterian. They think she contracted the virus when she was taking off her protective. They're also running some more tests, but they're confident. Hello, I think I lost your...
I do think we're having problems connecting with you, John. I don't know why. I guess, well, the internet's really acting up today. I will try to reconnect with John and get back to him on the latest on the health worker in the U.S. who has been identified with the Ebola virus disease. But we continue coverage of the Ebola virus disease, this time in Spain, which has recorded an update of the virus disease in Spain, which we'll be bringing to you later as we move on to the ISIS updates in order to play its part in combating the Islamic State. In Turkey has agreed to allow moderate Syrian rebels to be trained on its soil. The announcement was made by the U.S. National Security Advisor Susan Rice, who announced the development. And now it has not yet been confirmed by Turkey, who has refused to send troops on the ground into Syria and in Turkey. But Turkish MPs recently passed a motion allowing foreign forces to use its bases for activities in Syria and in Iraq. The U.S.-led coalition is carrying out airstrikes against Islamic State militants who have seized large parts of Iraq and Syria. Many have targeted ISIS around the key Syria-Turkey border town of Kobani.
Sounds of gunfire and explosions. This is Kobani, the northern border town of Syria, where peace has gone to sleep for some time now. The Islamic State militants earlier today launched fresh attacks on the Kurdish forces, bringing extra tanks and artillery to the front lines. The prospect that the town could be captured is disturbing. The United Nations has called for international action to stop the Islamic State and avoid a massacre.
The city of Kobane has been under siege now for 3 weeks. There were 400,000 inhabitants. They've been defending themselves. They're all Kurds. They've been defending themselves with great courage. But they are now very close to not being able to do so. They are fighting with normal weapons, whereas the ISIS has got tanks and mortars. The international community needs to defend them. The international community cannot sustain another city falling under ISIS.
Meanwhile, hundreds of Kurds in Paris have taken to the streets to register their displeasure at the state of affairs in Kobane. The US-led coalition is continuing airstrikes against the IS, both in Iraq and in Syria. But the Kurds now say they are running out on weapons and ammunition and will urgently need some replacement.
When we come back after the break on The World Today, investigations continue into the crash of the Malaysian airplane MH17. But the Australian Prime Minister Tony Abbott has a bone to pick with Russian President Vladimir Putin. Please join us again. Welcome back to The World Today. We have more now on the situation with the health worker in the United States. Officials closely watching Nina Pham. She's now been identified. That's her name. Nina Pham's condition, while the WHO has warned against irrational and disorganized efforts to avoid infection. John Walker joins me now. John, I hope you stay this time. Thank you for being patient with us. Tell us more now about the status of Nina in the Texas hospital.
Well, Nina is in stable condition right now, and she's being watched very closely. They're investigating on how she contracted Ebola. They think that it happened when she was taking off her protective gear. But that's just a theory right now. Since she has been diagnosed with Ebola, there's been a lot of outrage in the U.S. medical community. One, saying the nurses need more training and hospitals need to be more prepared to take in Ebola cases or other infectious disease cases.
Well, I've been wanting to ask this question, John. Were U.S. health workers, were they ever prepared for perhaps a case of Ebola in the U.S.?
Amarachi, you're absolutely correct. No, they weren't prepared. And they're discovering all around America that they're going to have to do intensive training, they're going to have to do drills, and they're going to have to make a much stronger protocol to address potential Ebola cases, address potential infectious disease cases. It's a hard lesson here in America today.
Well, it's not it's a lesson learned anyway, but it's one that can be learned over time. We understand President Barack Obama's ordered that major airports around the country be you have a protocol at the airports with checks on Ebola and so on. But what other measures have been taken to help curb any possible cases that may show up in the next few weeks?
Well, President Obama, has met with the Secretary of Health and Human Services. And together they've launched an investigation. They're going to be setting up new protocols at hospitals around the country. They're going to start with training. They're going to start with doing some drills. One of the things we're seeing immediately at New York's JFK airport is Ebola screening. When I left Lagos several weeks ago, they took my temperature, they asked me questions, and then they took my temperature again before they let me on the plane. Now